Hi guys, it's Sheena from Teton Raptor Center and I'm here to give you all this week's patient update, so let's go ahead and get started. To kick things off, I want to highlight a couple of our recent releases. This long-awaited bird is Golden Eagle 313 that came from Hamer, Idaho back in March and suffered a fractured coracoid and a ruptured crop, so we're really excited to get him back out there. Our second release of the week is another Golden Eagle. This is Golden Eagle 7-3 that came from the Salmon Falls area of Idaho and has been reunited with his parents as he was a recent fledgling. Moving right along to our current patients is American Kestrel 721, and this male fledgling came from the Idaho Falls area and was really thin and cold upon intake, so our goal is to rehydrate and get his weight back up to a healthy level and then get him back out to the wild. Next, we've got all of our fledgling hawks living together. In this little clip, you can see red-tailed hawk 714. And then in this video right here, you see both Swainson's hawk 7-7 as well as red-tailed hawk 714. They came out to get weighed, and so that's why they have their little hoods on, and they're just happily calm sitting there with their hoods on. They don't really move around too much, as you can see, so they're able to get weighed a lot easier that way. And then we have a couple of our other babies, Swainy 7-9, and we've also got Swainson's hawk 7-12 here for out for their weighing check. All of these young hawks are living together in the PCU and they have a great appetite, and so far so good. We plan on getting them re-nested once they're a little bit older so that they can be of fledging age. Next up, we've got Bald Eagle 710 from Idaho Falls, and this juvenile bird came in with severe feather damage, so she will most likely be here for a long time until those feathers can regrow. We think that she might have had this happen due to West Nile virus, which is treatable in her case with supportive care. Next up, we've got Great Horned Owl 711, and this bird also could be a victim of West Nile virus, which again, treating with supportive care. Supportive care in this case involves an anti-inflammatory, an antibiotic medication, as well as ivermectin, which is a drug that is used for parasites, so it treats parasites, and that could be helpful in fighting off a mosquito bite in this case. Next is Great Horned Owl 7-7. This bird is dealing with a fractured ulna and did not require surgery to have anything repaired, so that's really good. He or she is acting as a foster parent to Great Horned Owl 711. So we've got the adult living with the baby in the ICU together. And this is a great thing to do when you have a baby bird, because then the baby can learn from an adult what to do when they grow up. So it's able to watch the adult feed itself and practice normal great horned owl natural behaviors, and that will help it so that when the baby grows up, it kind of knows what to do. Next up, we've got Golden Eagle 7-6. This bird came in from Kemmerer, Wyoming with some soft tissue damage to various parts of her body as well as eye trauma. All of the soft tissue damage has healed up really nicely, and the eye trauma was treated with medicated eye drops that have really helped her out a whole lot. So she'll actually be moving to the flight barn in the next few days. We just want to give her a little bit of more time in the PCU to make sure that she is reliably self-feeding on her own, and then she'll be able to move to a larger space to begin flight conditioning. Last but not least this week is Golden Eagle 3-9, and this is the bird that came in with a metacarpus fracture that has now healed after surgery, as well as feather damage to her right wing. So until those feathers grow in, we can't really begin flight conditioning, but they're growing in really quickly. So hopefully in the next month, we'll be able to move this bird into the flight barn as well to begin flight conditioning. All right, that's all we've got for this week. Thank you guys so much for tuning in, and I hope you enjoyed learning more about our birds. Remember that if you want to do your part to help keep wild birds wild, you can check out our website at tetonraptorcenter.org and make a donation. I'm also going to link that donate button in the description below, so be sure to click on it there. Bye!